injecting as you withdraw, but it's a little mean to go all the way in without giving them a little. And pork tends to suck up the medicine a little more than human flesh, so it'll really, the resistance is different. So it's easy to over-inject and be out. So you want to, before you cap all your needles, you want to make sure they're numb.
Oink, oink.
You can always offer them a little more pain med, Dilaudid or Xanax if they're uncomfortable. That's a joke.
That was a joke, yeah. That's what I thought.
A little response, please. Okay.
Who's taking it, the patient or the...
Oh, I am. 90% of addiction doctors had an addiction, they say, at some point. I'm not an addiction.
90% of people.
I just found out the other day that Ringo Starr was addicted. I never knew that.
I have dependence. Isn't that terrible to admit? Well, what's the definition of dependence?
I don't know.
You get withdrawal. You know what I'm dependent on?
What?
Starbucks.
Stop.
I get a headache. That's withdrawal, right? Okay. Little angled stab incision. I like to put my fingers on a patient so that if it's very bouncy skin, when you pop through dermis, you've got a stop point, just like when you're looking at little kids' ear. So a little poke, boom, I just pop through. You can practice multiple times, boom, you just feel that pop. We got no dermis here, but you can still get the sense of that. If you put in a central line, you did that, right?
Mm-hmm. Mm-hmm.
Wow, we're gonna see.
Hmm?
If you do this right, I'll let you put my central line.
No, you really don't want that. I had a very empathic nurse guiding me through every step as I...
So when you hold this, I like to teach people to hold it thumb on the blue and a finger under here, because then they're not struggling and it makes it easier the first time. It's like learning how to hold a guitar right the first time. It's not required, you know, Jimi Hendrix played it different, but I would do it this way. I like to help you along, so ask us how to hold it when you're starting again.
Okay.
So you enter in your incision at no more than 20 degrees. You bury the distal tip, right? At that point, you go horizontal, and you see this hold allows me to go superficial and tent and lever it and tent it. So I'm going to stay as superficial as I can in pork. In human skin, the dermis is going to keep you from popping through because my bevel is up, and it's going to slide along dermis. Now if you pop out, that's the pork. It's not my technique, okay? It means you're staying superficial. We like to see that more than we like to see this.
Okay.
So you just redirect if that's happening, and you bury the mark. If you don't bury the mark, you're going to insert closer to the opening, and you have theoretical higher risk of a spontaneous expulsion. We don't want that. So I'll stabilize with my left. I'll take this out, grab an implant with my soft fingers, insert. I'll insert this to the stop mark on the obturator. I'll look over and make sure it's between the blue. At this point, I'm going to anchor with a different hand. My right hand was in motion. Now I'm going to use it as an anchor. I like to put it down and hold it. And nothing can go wrong if I don't move my right hand, right? And the only motion is moving back into my right hand. Once I hit, remember to lock first. At that point, you still have to get out far enough to redirect. So you'll get back toward your hold, put a finger on near the opening, and in this way you're helping keep that implant up, and you'll feel it pop off right as the black mark comes into view.
You will palpate it a little bit.
You'll
at
feel
that
it
point.
pop if you
Yeah.
put it in superficial. Right there's black. Come out a little so you can see it. Okay? At that point...
There's your black line.
Yeah.
Okay.
At that point, you're going to redirect. I leave a finger here and I kind of pull away to allow myself to have a sense that I'm not ramming butt into implant number 1 as I go down track 2. And I made this a little narrow, so I really want to make sure I didn't hit it. You see I'm back to superficial, tenting and hold it, tenting, leveraging, driving with this hold, and it stays horizontal. So now we're just rolling through 2, 3, and 4, removal. Bring back the obturator to the stop line between the blue. Hold behind, retract back, lock, control the pop off, boom, and look for the black. I'm all ready to redirect to channel 3. feeling like I'm not hitting that butt end. Leveraging, superficial. And I'm tearing my pork a little bit. Don't be upset if that's you. This pork tears, so yours isn't going to do that. I mean, your patient's not going to do that. Don't be upset if yours does that, and don't think I'm the third worst trainer in history. To the stop. Anchor. Retract. Lock it. Control the pop off.
It's nice that it's repetitive because you get to do it over and over again.
You do it as much as you feel comfortable.
Yeah.
I would, because of the tear, it's a little tricky. Because I'm tearing it more. So I'm trying to respect as close to what it would be. To the stop line. Anchor behind. Retract. Lock it. Keep it in as you retract it entirely, and you're done. So look where we are. Sterile pause. We're all the way at 16. I feel 4. So we're going to do our 3 steps of wound care. Mastisol just a little bit, goes a long way. Just sticky, not soppy wet. You don't have scissors because we all cut Steri-Strip with scissors, so we just didn't give you any because we figured out you can just score it in here to fit a Band-Aid. And I like to tap it down and pull it across to alleviate tension. And why not use these little 2 that I have here? And so most of us tend to do it like that. Bandage. Hardest part of the procedure is not getting the Band-Aid stuck to your glove if you continue to wear gloves. If you're going to put a pressure dressing on, a little elevation is always nice. So I tend to use clean gauze here. Pressure dressing. Doesn't say you have to use the ACE rep that's supplied, but it is supplied. Just make sure the Velcro doesn't bother them. You don't want to make a tourniquet out of it. I've been told by a wound nurse that 50% stretch is never a tourniquet. So if you want to take 6 inches and make it 9, that's a good objective way to figure out how tight to make an ACE rep.
6 inches and make it 9.
50%.
50%.
50% stretch. Feels right, so I stick with it.
Steri-Strips, pressure dressing. No, Steri-Strips. What's the middle layer called?
Bandage.
Your bandage, and then pressure dressing. Yeah, and they're going to come off in that order.
It's not an open book test, it's an open book procedure every time you do it.
Yeah.
But yeah. And they come off in reverse.
Yeah.
When do they take this off?
The next day.
And the bandage?
2 to 3 days.
Sure, 3 to 5. Steri-Strip.
They're going to fall off over time.
And what are you telling this patient?
Ice it.
There you go. And set them up with the appropriate follow-up that all of these folks should have. Mindfulness, CBT, whatever you think is right.
12-step facilitation,
I
motivational
was
interview.
waiting. I knew he was going to give me a few. There we go.
Love, lots of love.
That's right, emotional support. Okay, so your patient comes back.
How often do they, well, you go ahead. How often do they complain about pain? Do you give them like ibuprofen or anything for the next day, or it doesn't happen? I mean, they're on a pain.
Yeah.
Yeah.
You're on a pain med.
Yeah.
You won't need anything. You know what I tell them?
And it probably has some localized action, right?
I
Because they're
tell
getting
them
it right
you can
there.
take some over the counter if you really need to, but most don't. But
Most don't.
Ice is your best friend.
Ice is your best friend.
Give
Okay.
them that to do.
Yeah.
And that's actually true.
Yeah.
That's what I tell my vasectomy patients, and I can vouch for the fact that ice is the way to go.
The way to go. Okay.
Yeah. Okay.
Anything special when they go to sleep at night? Like just it's bandaged
Benzos.
is fine. Lots and lots of benzos.
Yeah, other than that,
However you can get them, really.
Benzos or endos?
benzos are key. Yeah. Just make sure they're not gonna run out of their benzos.
Right,
They'll be
right.
fine.
Yeah, I never do, believe me. For every opioid addiction, maximum benzo dose is the way to go.
Oh, good.
Mix and match, I
Gotta
say.
Come up with a little marketing.
Yeah, sure, yeah. Just stick a couple Xanax in there with the implants. It'll really make the medicine go down.
Just wanna see those 11 closing, that's all.
No problem. Keep it with. So we're gonna go through removal. So if you look at your removal steps,